I'm Bill Patterson. I'm the VP of R&D and Operations at Sequent Medical. The LINNC meeting's been instrumental in the Sequent story. Many of the physicians here, and in fact Professors Murray and Spell, found the meeting, have been instrumental in helping us move through the different design of evolutions that we've gone through with the product. And most notably, they've done several live cases here with the technology and really showcased the technology. It's been very important to us. So the web's a unique device. It's a braided object made of several different diameters of very small wires, braided into a cylindrical or spherical-like structure. That object then, or device, is guided into the aneurysm, much like coils are guided into the aneurysm. But the web is a single object. It's placed in the aneurysm, it's detached, and then from that point on causes a thrombosis and eventually a healing of the aneurysm. It's always difficult to be new and different in a field. Every device that comes to these physicians goes through that new learning curve, and certainly that's what we've had to go through in the 6 years that we've been doing this. And yeah, maybe to bring it back to the LINNC meeting, the LINNC meeting's been important for us to come and get feedback on that evolution of that technology. Where do we go from here? It's too big. Let's make it smaller. It needs to go through smaller catheters. Let's get it through those smaller catheters. And that's been part of the process that we've gone through over the years here.
And the material it's made from, is that also an issue?
It's nickel titanium called nitinol. Yeah,
right.
That's what the wires are made out of.
Are you researching other materials, or does this seem to be the one that you've
Yeah,
found
it's a great point. So we started off with what's called pure nickel titanium, or nitinol, and then we moved into a new material called a composite wire. It has a nickel titanium or nitinol outer shell and a solid platinum core inside of it. And again, the LINNC meeting was instrumental in getting the feedback that we needed to make the device more visible, and it's that platinum core inside the wire that makes the device more visible.
Of course, because if you can't see the device, it's going to be difficult for the physician.
Very difficult to work with. Yeah.
And that's the kind of exchange that I suppose a meeting like this is essential for.
It's absolutely true. Only happens here. Yeah. So next year, I'm really looking forward to the smallest system that we've ever produced. It's a series of devices, 3 through 7 millimeters, that are going to go through what is commonly in our space called a coil-sized catheter. So a so-called 17 system. That is, the inner diameter of the catheter is 17 thousandths of an inch. And so I'm really excited about bringing these products forward. We started in such large catheters, and all the physicians were instrumental in saying, please make this smaller. We know you can do it. And it's a very hard problem to solve, but I have a very talented team. And then with the guidance of my boss, the CEO, Tom Wilder, we've been able to reduce the system down to this coil-sized technology. We're really excited to bring this forward.
What stage are you in the preparation of that?
Yeah, so the design and testing is finished. We're waiting for regulatory approval. We should have these devices out in what we call physician preference testing in the second half of this year.
Well, that's very exciting. So we look forward to talking to you about that next year.
Next year at LINNC, we should have a live case with the 17 system.
Well, thank you very much for being with us.
My pleasure.